My name is Roman, and I am a La Selva graduate. I was raised in a first-generation Mexican-American household where physical violence was almost a weekly event in my home. I began calling Friday nights fight nights because that's the day my father would go out drinking after work and come home intoxicated. My mother would get angry, and violence would then ensue. Growing up this way, I became secretive, fearful of conflict, and somewhat reclusive. Add in generational trauma, and I was a powder keg waiting to explode.
The Selva Group is a division of Momentum for Health. We have 3 levels of care in the Selva Group. We have a residential program, and then afterwards, partial hospital program. And from there, they can step down to our intensive outpatient program. Roman was really a pleasure to work with. I think he deserves a lot of the credit for his recovery because of how committed he was to his treatment. Always participating and engaging, and he would then encourage a lot of patients to do the same. So he actually helped a lot of his peers by being so engaged.
One of the best parts of residential was the sense of community. Everyone there shared a common purpose, healing. And that made it easier to open up. As time went on, I began to feel both the return of the old me and the emergence of a new me. By the end of my stay, I felt mentally stronger, though not yet ready to return home. Thankfully, La Selva also offered supportive housing. While in supportive housing, I formed deep connections with my housemates. We would stay up late, talking about everything and anything. Those were the conversations that really became a cornerstone of my healing.
Roman had a lot of struggles that really came to fruition while he was here. I'm glad that it happened here where he could have the care and support. And, we always preach honesty, open-minded, and willingness. And he really took all of that. He practiced the skills, made the skills his own. And all of the interactions I have heard from clients is father figure, because he's so good at being there for others, taking care of other people. That's Roman.
While in supportive housing, my spouse told me she wanted a divorce just one day before our 21st anniversary. My vision of recovery was completely shattered. I had imagined returning home to my loving wife and daughter, but instead, I was returning to an empty house and a couch. Thankfully, I wasn't alone. Other men in supportive housing were going through similar experiences, and through our conversations, I learned that healing isn't about being fixed. It's about learning to cope and adapt. My care team helped me process the pain and see the change as an opportunity for rediscovery. Over time, I began to accept that me truly means just me, and that's okay. I started exploring new career opportunities and learning how to reconnect with people. For the first time in a long time, I felt grateful simply to be alive. Realizing how meaningful community had been in my healing, I spoke with staff about staying involved. They suggested becoming a peer support specialist, and now I'm working to earn that certification so I can help others on their own path to recovery. I now look forward to each new day with hope. I've learned coping strategies and resilience that will stay with me for my life. And I know that if I stumble, I can always reach out and simply just begin again.